I'm Dr. David Bartos, and I'd like to talk to you today about the eradication of the spider veins. We are now able to offer the public the ability to get rid of those ugly little purple and blue lines on your legs and calves and ankles that all you ladies experience. We are able to do this in a fashion such that we can destroy the vessel permanently, and hopefully you'll never get it back again. I'm always asked, Doctor, is it possible that these veins, if I ever need open heart surgery, will be used and that I won't be able to have my life saved? And my answer always is with a smile, these veins are not only no good, they're so teeny tiny that these are the wrong veins. So let's clear the air immediately that these small little teeny tiny little veins that are about the size of a piece of thread are not the ones that the cardiac surgeons are using to graft from your leg up into your heart. These veins are typically the ones that are used deep in the legs that are used for the harvesting of grafts, and these are not the ones we're talking about the eradication of. So let's move on with the discussion of the spider veins. These again are these clusters of veins that are typically seen around the knee and thigh area, the back of the calf, the front of the leg, the ankles, and I'm always told by patients that I'm embarrassed to go to the beach. I can't wear my bathing suit or shorts anymore, and I just don't like going outside because of them. Well, now we do have the ability to get rid of these, and very successfully. We use a combination of two techniques. We will use in some of the larger vessels a little saline injection, which is a little saltwater solution in a very tiny syringe that we just inject into the vein, and it moves through and courses through the vein, and it helps destroy the inner lining of the vessel. And to finish the treatment, we use this radio wave probe, which is I'm holding in my hand here. And it has a very teeny tiny little probe on the end that's about the size of one of your hairs. And it's not something that we inject into you, it's just that we touch the surface of the vessel. We just walk along wherever the vein is. About every 2 to 3 millimeters, we activate a little foot switch, and we just go along here, and it's relatively pain-free. We just walk along wherever the little vessel is, and it collapses the vessel. You can actually see the eradication of the vessel as I'm doing it. To maintain this correction at the conclusion of the treatment, what we'll do is we'll put a piece of foam pad over the area and wrap this with an ACE bandage, at which point then you will be leaving the foam pad and the ACE bandage on for 3 days. You'll be able to take it off for normal bathing and showering, and then I want you to reapply this as soon as you're done with your bath or shower. After the 3 days are up, you'll be then wearing your surgical support hose either to the knees or thigh highs or pantyhose, whatever is more comfortable for you. And that typically lasts for about a week. The usual protocol that we have in our office then is I will see you 3 weeks in a row for one session. One session consists of an area of destruction of vessels approximately 6 inches in diameter. That's about the size of the circle I'm making with my thumb and fingers. So if we translate that down to our leg, and we put this down on, say, like the calf area here, you can get a good sense of, if this is my knee here, and we're coming down in the inside of the calf, you can get rid of an entire area about this big around your calf in one session. So if you have an area here and an area maybe further down on your ankle and maybe one up in back of your knee, that could be 3 distinct areas that we'll be working on at 3 different times. We don't move on from one area to another area until we've successfully completed the eradication of these vessels in the area that we started on. Typically it may take anywhere from 1 to 3 sessions, and that's one session 1 week. You come back a following week, we check it to make sure it's gone. If not, we'll touch up the areas again at no charge, rewrap these. You'll follow the same protocol at home with wrapping with the ACE bandage and keeping it on except for bathing and showering, and then reapply it. And then you'll come back a 3rd week and we'll check it, and typically by the 3rd week it's gone, and then we move on to the next area. We're really excited about this treatment program, and I know we can give you the cosmetic as well as the good functional appearance that you're looking for.